So good evening. The University of the Philippines Medical Informatics Unit serves under the office of the Dean of the UP College of Medicine. And it's this unit that put together the Philippine Telemedicine Guidance documents that I'm sharing with all of you tonight. So I've divided my presentation into three parts. First, to explain our deliberate use of guidance and not guideline for our documents. Second, how we chose the topics on the guidance. And lastly, what's next? Can we evolve from guidance to guideline? So this is a screen cap of the first Zoom meeting on April 7 of some of the individuals who worked on the Philippine Telemedicine Guidance document, and some of them are in this call. They are my health informatics graduate students, alumni, and some faculty of the Medical Informatics Unit. If you look at the top of the picture, it says there is one non-video participant, and that is Dr. Alvin Marcelo, who is also on this call tonight. Prior to that first Zoom meeting, the team began 2 weeks before in March, putting together a literature search on Slack. All drafts were on Google Docs, and we had 1-hour meetings every Monday to check in on each other. That we were doing something together amid the pandemic was definitely good for our mental health. So, why did we call it guidance and not guideline? What's the difference? Well, because guidance is basically advice. A guideline is usually a set of rules, and in the Philippines, it would be the medical specialty organizations who would usually come up with the guidelines. And having been involved in guideline development myself for dyslipidemia and diabetes, I knew that the established processes for guideline development was quite long and arduous, and we were in a hurry. But what we were very clear about when we started making the documents was who was the guidance for. So our intended audience were first the Filipino physicians intending to engage in telemedicine due to the disruption of healthcare brought about by the COVID-19 pandemic. So I think it was around March 16 when the island of Luzon in the Philippines was placed under community quarantine, and we've been under different kinds of community quarantine since then. We also wanted to address our documents to the Filipino lawmakers that they may consider the gaps in the current legislation on telemedicine. Currently, we have several e-health bills still pending in the Senate and in the Congress and waiting to be passed. And that would be around the fourth one already. They've been trying to pass e-health legislation for several years. We also wanted to dedicate the guidance document to our medical educators because we knew that we would have to develop telemedicine training along the way. We also wanted to speak to the medical specialty organizations who we hope would be preparing specialty specific guidance because we hope that they would agree that telemedicine would have its place even beyond the pandemic. We also wanted to touch some points with the telemedicine platform developers and providers who support teleconsultations, and also to our Filipino patients who are mostly unfamiliar with the teleconsultation process. So, what's on the guidance? We actually began with more topics, but stopped at 5 documents. We combined some topics we had, and there were also topics that we gave up on as we felt we didn't have enough to be able to write the guidance. So our guidance is still in a Google folder, and you can go to bit.ly/UPMIU Telemed 2020. You'll find 5 PDFs in there. And so we are hoping that we can update them and release in an ebook format soon. So these are the 5 documents. And as you can see, if you look at the dates, we were trying to release them weekly. Some of them we released within like 10 days and some of them within a 2-week gap. So we had telemedicine guidance for physicians, teleconsultation, preparing for a teleconsultation, guidance for assessing telemedicine vendors, and Telemedicine Guidance on Navigating Ethical and Legal Implications was the last document that came out on June 3, 2020. So when we tried to format our guidance, each document had questions and to which we provided what we call TLDR answers. Yes, too long, didn't read answers before discussing it more in length in the main body of the document. The questions were generated by our group based on our own questions at that time as clinicians trying to set up our own telemedicine practices, and those that we received from others who were doing the same. And of course, I was also in the academe, so we were getting some queries. So for example, for the first document, Telemedicine Guidance for Physicians in the Philippines, we asked, who can practice telemedicine? And that was not only a legal question, as the Philippine Medical Act of 1959 defined physically examining a patient as practice of medicine, but it was also a question of capacity. Hence, the next question was on minimum competencies to practice telemedicine. As this was a guidance and not a guideline, we were suggesting competencies for medical educators and perhaps also to accrediting bodies later on, even as the accreditation process was not yet in place. And then we had question on the minimum requirements for setup. Practical questions for the Philippines were Wi-Fi is low, spotty or non-existent would be something as practical as what would be the minimum internet speed for a video consultation? What's the minimum number of megapixels for a camera if I were to ask a patient to take a picture? How about the room requirements and the lighting setup? Since both patient and physicians were likely to be meeting each other from their homes because of the quarantine. In the second document, we discussed different types of teleconsultation. Is an email exchange enough for teleconsultation? How about chat or SMS? Because we do have a lot of mobile use in the Philippines. How is a virtual physical exam performed? So instead of getting stuck on the limitations, people were telling us, how can you do that? It's just a webcam, etc. We sought to list down what actual virtual PE maneuvers can be done. In fact, at one meeting, when I was talking to a group of internists and telling them about the virtual PE, an experienced pulmonologist told me that maybe we need to teach our students because I know that I can tell what underlying lung disease someone has by just listening to the sound of his cough. So I guess it was born out of experience, but now that we need that kind of experience, merely hearing a cough and sort of being able to tell what the diagnosis is. And since the pandemic was also the first time that so many Filipino physicians were trying out telemedicine, we wanted to showcase some examples from the literature. Now, in the rest of that document, we also asked, how can we safeguard both the physician and patient in a teleconsultation? And you might ask, why? Why both? Okay, both because physicians who were unfamiliar with telemedicine were telling us that they were afraid of making errors, be it that they were not tech savvy enough, they did not have the requisite competencies, or they were unaware of the legal requirements like obtaining consent, but also now knowing what would be considered good quality teleconsultation. So we also decided to include a step-by-step teleconsultation workflow, which many of the readers of our guidance found very useful. So we had what to do before the visit, during the visit, and after the visit. So it's all in our guidance document. By the third document, we realized that not only were Filipino physicians needing guidance, but also the patients. And so we asked, how can physicians help patients prepare for the teleconsultation? What do we expect them to do beforehand, during, and after the teleconsultation? The pandemic made access to in-person care difficult, and we wanted to keep our hospitals from getting overwhelmed by the worried well. So we also asked, how can physicians ensure that teleconsultations empower patients and support self-management? because we wanted to support self-efficacy, especially for those who had chronic disease. So I'm an endocrinologist, so I was seeing a lot of patients with diabetes and hypertension, for example. Now, many patients, understandably, were now scared of going to the hospital despite really needing to. So we also sought to answer a question on the limits of teleconsultation. What's possible and what's not, so as to make it clear for both physician and patient. So by this time, and this was the fourth document, guidance for assessing telemedicine vendors, so many telemedicine platforms are already cropping up in the Philippines. And I would often get asked, Dr. Isip, what telemedicine platform do you use? Is that the best one? Is that why you're using it? Why did you choose that? And so for this fourth document, this was really our attempt to put together a guidance for physicians and practices or hospitals maybe to assess telemedicine vendors. So what to ask? What are the considerations when selecting a telemedicine platform or app? So we put together an assessment checklist. So I thought the next time someone asks me again, what is the best telemedicine platform, I could point to this checklist. But nobody wanted to use it. Well, at least the doctors, they would tell me, I don't want the checklist, just tell me which one and I'll get it. So we also attempted to loop in the local telemedicine vendors. What we did was to send out the checklist to them for a self-assessment, but only 2 or 3 returned responses. So we even had one company who returned responses that were different. So it didn't really work out. And though we had discussed some ethical and legal issues in the very first guidance document we released, we continued receiving more in-depth questions for navigating ethical and legal implications. So the process in this last document was a bit different because we didn't really have in the group ethics and legal experts. So we prepared, did our literature review, prepared a draft, and then we asked for comments from the legal experts, the local ethics experts, and if you look at our document, the fifth one acknowledges them as well. So dealing with conflict of interest was one of the questions we addressed. We got a lot of questions about how much should a physician charge for a teleconsultation? Should it be higher? Should it be lower? What are the considerations? We wanted to actually say outright, don't use social media because we have data privacy, security, confidentiality concerns. But instead of saying that outright, we actually discussed the ethical considerations when using social media platforms because a lot of Filipino physicians were also using, for example, Facebook Messenger. There were so many queries about the process of obtaining consent for telemedicine. In our second document, we basically discussed the elements of a consent form, why we're asking for a consent form, because people were telling us, people see me in the clinic, I don't ask them to sign a consent. So why is it when it's a telemedicine consult, they have to sign consent now? And do we have to do it at each and every visit? So in our second guidance document, we put together a sample consent form, and then we had it in 2 formats, in English and in Filipino, but it was 3 pages long. So people were telling us, well, if we were only doing it via SMS, would it be enough to say for the patient to text back, I agree? If it were on a telemedicine platform, can they just check a box that says, I agree? If the telemedicine platform has some sort of waiver, is that enough, or does the physician have to have a separate consent form for the teleconsultation? So that's why we had to come up with the 5th document. So after completing 5 guidance documents, we rested. No, just joking. So, a guidance is only as good as if people know about it, then hopefully they will follow it. So the next step was actually, can we evolve from guidance to guideline at last? So as the documents came out, and they were coming out like almost every other week, we shared them in real time on Facebook, Twitter, Viber, and when you share them, more questions will come in, and then we'll tell them, oh, it's gonna come out in the next document. Yes, we'll answer that question maybe in a couple of weeks. So my health informatics students prepared social media cards. Because we noted that if we share just the link, we weren't sure if people were going to get enticed enough to open the link. So we would put little bits of information on the social media cards, as you see here, like who can practice telemedicine. Then if they open the document, they can see the longer explanation or the legal background, etc., about the answer to the question. And at about this time, I also began getting invites to talk about telemedicine at the webinars, both in the academe and by the pharmaceutical companies, mostly because people wanted presentations of the guidance rather than them reading the document. Some of them would be around, I think, 10 to 15 pages long. What you see here is a screen capture of a YouTube video. In it are two of my health informatics grad students. Dr. Justin Yu is a neurology fellow, and Mr. Herber is also in the video as the patient. So Justine was demonstrating how to do a virtual neurologic exam in Filipino. So she was giving instructions here for the maneuvers for Burr to do, because really the virtual PE was one of the questions that really people were asking most about. So this was our guidance document in action, actually. And then we have this. 5 days after we released our fifth and last document, the Joint Memorandum Circular of the Department of Health of the Philippines and the University of the Philippines, Manila, was released. The subject of this Joint Memorandum Circular was the Telemedicine Practice Guidelines. And in the reference list, you'll be able to find all our 5 guidance documents from the UP Medical Informatics Unit. So yes, I can say we went from guidance to guideline after all. Now, neurology, since then, neurology, pulmonary medicine, dermatology, rheumatology, have released telemedicine guidelines for their medical societies in the Philippines. Last August, I was a plenary speaker at the Philippine College of Physicians Annual Convention. Next week, I will be a plenary speaker at the Philippine Pediatric Society. And in December, I will be the plenary speaker at the Philippine Society of Otolaryngology and Head and Neck Surgeons. And can you guess what the topic is all about? It's going to be about telemedicine. So like in the meeting at August, I will talk about my call to action for the medical specialty organizations. And what are these? First, that the societies need to establish core competencies to enable us to use telemedicine for training. There's a lot of inquiry right now because, for example, our medical interns have very limited experience with patients because of the quarantine, because they need also PPE if they're going to go to the hospital. So training has been severely limited. And then if you want that telemedicine will really be part of training, then we really have to list down these core competencies. Number 2 call to action is to set the scope and standards of care. So that would involve perhaps saying which kind of patients or cases or conditions would be amenable, would be appropriate for a teleconsultation, and which would not be, because after all, this is a patient safety issue. And the last call to action is to enable implementation of research. And usually we would be talking about quality improvement studies, perhaps, or actual implementation research, because our local contexts will be different. So one example is for the Philippine General Hospital, which is the national hospital that is associated with the University of the Philippines, Manila. Most of our patients are indigent. They don't have access to internet. And most of them right now are fellows, are residents in training, are getting in touch with them for teleconsultation via landline or phone calls only. So you know how an audio consultation would be limited as compared to a video teleconsultation, but then we need to sort of do the implementation research on how that can be safely accomplished because that is what we have right now. We don't have access to Wi-Fi for everybody. That's it. I really kept my presentation short because I'm really excited to hear about the experiences from the other countries as well. Thank you.
Okay, thank you for the insightful lecture, Dr. Iris. Let us hear from our first director, Dr. Mitsambat from Cambodia.
Thank you, Surin, for the introduction, and thank you, Dr. Iris, for your great presentation about the telemedicine during the COVID-19 pandemic. So in Cambodia, we don't have much about the telemedicine, especially for the COVID. So far, we have some practice for the telemedicine, but by a hospital with abroad physician, like in a national hospital for the neurology and some for the traumatology. But during the pandemic for the COVID-19, we only have the hotline that set by the MOH, Ministry of Health and Department of Communicable Disease. So we received the on-call for the question answer through the hotline for the COVID-19 situation. So we don't have practice or have any guidelines set up yet for the telemedicine in Cambodia. So I have some question for Dr. Iris. When you have the guideline for the telemedicine, they also adopted by the Ministry of Health, and also do you have like a hotline? Is the people or client can ask the question about the COVID-19 in Philippines?
Yes. So the joint memorandum circular that was released on June 8th by the Department of Health, our Ministry of Health, was written together with the University of the Philippines, Manila. And so that's how the guidance documents that we made from our medical informatics unit became a guideline because it was referenced and quoted heavily in that document. We also do have a hotline. The Department of Health in the Philippines has a hotline for COVID-19. Our hospital, the Philippine General Hospital, also has a hotline that we call the Bayanihan Center, also for COVID-19. And the plan for that actually, once the pandemic is over, the hotline will remain and it will be transitioned into a telemedicine service as well.
Okay, thank you. That's all from me, Surin. Yeah, over.
Thank you, Dr. Mitsambat. Next, we invite Dr. Yadanar Aung to share her insight.
And in Myanmar, as of today, the COVID-19 positive confirmed cases are over 70,000, and also the death case is nearly 1,700. So as of today, the third highest COVID-19 confirmed cases among ASEAN countries after Indonesia and the Philippines is the second highest. And also, even though we don't have an absence of the telemedicine practice guideline, and it is the right time to develop the telemedicine guideline in Myanmar at the time of social distancing and travel restriction because of the COVID-19 pandemic. The digital health solution like the telemedicine that connect to the healthcare providers and patients to communicate directly to the text online and chat platform, phone calls and video chats, and then the impact of COVID-19. Recently, we have a popular in the telehealth services, like the popular one is the Ziwaka teleconsultation that's established from the private sector. They charge us founded by the Burmese doctor, and they charge with the consultation fees with the healthcare providers and the patient who really don't want to go to the clinic or hospital, and they provide the mobile application designs for the patient-centered care and then innovators too. And also as a public sector, the Ministry of Health and Sports have ultimate responsibility of the Myanmar health system with the effective preventive and control measure of the COVID-19. And we developed the COVID-19 platform. In the Facebook, we make an account, the MOHS official webpage at the Facebook account, and we make that every Wednesday is the COVID-19 up-to-date information provided, and also we support the COVID-19 question and answer session with the live stream, and also DMR, my Department of Medical Research, provide the COVID-19 call center hotline number 2019, and anyone can call to the call center at the office hour for clarification of any information that they would like to get, and also some control and some guidelines to treat the at home for the minor illness and injury at the time of the COVID-19. That I'm curious about because we Ministry of Health and Sport made an account at the Facebook. In the presentation, you also mentioned that the privacy, security concern, and then for the telemedicine, this is not the recommended for Facebook application because of privacy and confidentiality. But the nature of the Burmese population, most are familiar with the Facebook app, and they are very short to the point to give and to communicate with the patients and the provider and to inform the information. So we made an account to give in question and answer sessions for every Wednesday. So is this how to initiate and collaborate to implement any web page or any telemedicine guideline in my country? And thank you for your very informative presentation, and really glad that's grateful to be a reactor of this vulnerable session. Thank you.
Thank you, Dr. Yadanar. Next, we invite Dr. Thepphouthone from Lao PDR to share his experience.
Thank you, Surin. The first, I would like to thank you very much, Dr. Irita, for your presentation. The telemedicine is useful for the communicable disease like a COVID pandemic to track the on case and contact people. I would like to say the experience in Laos. We have the good response for COVID pandemic. Right now, Lao PDR has only the 24 confirmed positive cases of the COVID-19 patient. We suspect only the 2,500 cases the test. However, the list of the transmission is increased in the number reports from the neighboring country, and the number of workers of the neighboring country who are forced to return home. The Lao government has identified the preparedness and respond to this health emergency. However, the capacity to respond to the effectively manage of the outbreak is considered limited. Therefore, MOH has developed the national COVID strategy, and the projects will improve health facility to support the country and respond to this disease. For the tagger, for the tag with the case, we have a hotline for COVID, and we integrate to the DSIS2 system, and we have the team from the CDC, communicable disease department, to analyze the message and screen the symptoms and travel information. COVID-19 DSA2 package has been developed by the WHO and the University of Oslo for capture the COVID outbreak in many countries. So now we use the COVID package on the DSIA2. In our country, we work closely with the WHO and the tech capture app for the COVID surveillance. There are 3 modules with the regard COVID patient, contact, and relationship, and returning people from the other countries. For the register, the new case, I mean the COVID case, there are 5 sections information will be filled out that suggest the patient demographic data and the history of the health and clinical information, travel history, and the exposure information. The fourth is the laboratory information, and the last section is the treatment outcome. Because now we have only the 24 cases, so we don't use the like your country telemedicine. But I would like to ask you about how you manage the information. I mean the feedback information from the patient, because your country has many islands. So I think it's really difficult to manage and to feedback to people when they have the question. That's all for my comment and question.
Thank you for your question. And that what happened was when we had the community quarantine, people had to stay put. I'm an endocrinologist, and the Philippines only has about 300 plus endocrinologists. So I had patients from other islands, and they were unable to come to Manila. So really, telemedicine was useful in that way because they could still get in touch with me, and I could still get in touch with them. But what happened was I also had to network with the physicians who were in their locality, because if they needed emergency care, which I could not provide via telemedicine, they would have to know where to go that would be nearer to them and would be accessible to them, so as not to violate the community quarantine. So as you have pointed out, the Philippines is an archipelago, and we have had the National Telehealth Center since the 1990s, because really, telemedicine was envisioned to be a way to reach our geographically isolated and disadvantaged areas. But what the pandemic has done is sort of accelerated the process, because now many healthcare institutions have seen how telemedicine can work in the pandemic, and it's unlikely that they will go back to not using it after the pandemic. But we need to sort of make our processes, our virtual care pathways better. And in the Universal Healthcare Law, which the Philippines recently passed, we really are talking about service delivery network. So that means connecting primary care to the hospital, etc. So that is really a very relevant question. Thank you.
Thank you, Dr. Iris. Thank you, Dr. Ted.
Alice.
Okay, next, let's hear from Dr. Pomtandat, his experience in Vietnam.
Thank you for the valuable presentation from the Philippine University. And I want to share the experience from Vietnam. In Vietnam, we have telemedicine law is very soon from the 2017. It is before the COVID pandemic appear, and in our telemedicine guideline, we define the responsibilities of the health facility of the consultation physician and of the direct physician. We have and we have a project about the telemedicine connect from the national hospital to the province hospital for the consultation. Is very soon, and in the pandemic COVID, the Vietnam government is pushed to develop telemedicine in the over provinces and over the hospitals in Vietnam. And in this year, the government have a conference to implement 1,000 hospital implementing the telemedicine system. And now we developed the national health digital transformation program. We put the requirement of each hospital should have a telemedicine system in the in each hospitals from now to 20 and 2025. But in the presentation, I impressed about the criteria of the telemedicine platform, because in Vietnam we don't have a telemedicine platform criteria, and we don't know how to select and to choose the best platform for the hospital, and each hospital asks the Minister of Health about the criteria, but we cannot reply them which criteria is the best for the telemedicine platform. And if the Philippines can sharing and guide us to evaluate telemedicine platform in Vietnam is very good for us, because in Vietnam now many company to develop the telemedicine platform, but we don't know exactly what is the best in this. Thank you.
Yes, thank you, sir, for
Thank
your
you.
comments.
Yes.
Wow, 1,000 hospitals to have telemedicine soon in
Yes.
Vietnam.
Is this year? Is this year?
That's very good. Regarding the assessment of the telemedicine platforms, the queries actually came from the private physicians here in the Philippines, but now we also have telemedicine platforms that are offering to
Yeah.
hospitals and connecting clinics to the hospital, etc. We
Yes.
we also have the Department of Trade and Industry. They also invited me because they were also interested in accrediting the process, and that would include the platform. So I suppose that somewhere someone will regulate these platforms. Right now, there's very little regulation because people are still trying it out and trying to figure out what's best. Our telemedicine guidance documents, I will put the link in the chat box for you to take a look at. Thank you very much.
And more information, in Vietnam we have 14,000 hospital and health facilities, and we want each hospital or facility have a telemedicine system for overall the facility in Vietnam from now to the 2025.
Thank you, Dr. Pam. Thank you, Dr. Iris. Last but not least, let's hear from our reactor, Mr. Lauro Vives, who is a represent for FIN. Dear Dr. Lauro.
Yes, hi, good morning, everyone. You have to forgive me. It's 5 a.m. in the morning here in Canada, and I'm still in my pajamas, so I'm definitely not camera ready at all. Thank you, Dr. Tan, for your presentation, and I'll look forward to getting a copy of the guidance. Certainly, advancements in technology, along with increasing digital literacy amongst patients and clinicians, have opened up an opportunity to enter a new era of care for many countries, not only in the Philippines, but in the Pacific as well. My direct experience on this topic is quite narrow, and therefore will focus on my experience guiding the country of Fiji with their first virtual care program this year due to COVID-19, and some of my experience in helping with our First Nations or Indigenous committees here in Northern Canada, where access to healthcare is constantly a challenge. So here's my perspective. Telemedicine works. I know it's not everything, nor is it for everyone, every minute of every day. Certainly not. But personally, after nearly 30 years of experience in a digital business, I have bear witness to how we always overstate the effects of technology in the short run, meaning to say that we are always optimistic of the promise of technology, but always underestimate the effects of technology in the long run. So in this one rare instance, on the other hand, like telemedicine, I believe this is not the case. Introducing telemedicine can really have an immediate and positive really positive direct impact on both patients and care providers. In the long run, and I really believe this, it will become a more efficient method for everyone to practice and access care, especially if there is a guidance document like the ones developed in the Philippines to shepherd the participants in using telemedicine the proper way. Because I have actually seen many countries, and not necessarily countries, but organizations that have not used telemedicine the proper way. And it has just become a very frustrating experience for everyone. No doubt, with the COVID-19 pandemic, adopting telemedicine has really supercharged this trend. But at the same time, as we all know, right, and this is true as well in the Philippines, a form of unregulated virtual care has emerged in most countries, if not all countries, during the pandemic. I don't think anybody was really entirely prepared for that. I don't think any country was entirely legally and regulatory ready to some form of telemedicine. So a guidance is absolutely necessary. So today, telemedicine has really dramatically changed the face of medicine worldwide, and including the Pacific. I really believe it is a preventive and proactive approach to care. The guidance developed by Dr. Tam's team are certainly the right things to do to put telemedicine in the proper trajectory early in the program introduction. Because again, based on my limited experience, clinician and patient onboarding is really often the most challenging period when rolling out telemedicine. So on behalf of the Pacific Health Information Network and its 23 member countries, congratulations to Dr. Tam in the Philippines for progress made in this frontier. Thank you.
Thank you, Mr. Lauro. Thank you for all our reactors for sharing the country experience. We now open for question. Please feel free to type your question in the chat box. Our first question is from Dr. Elvin. Some say consent is important, but it's also difficult to get this while patient is not at the clinic. What's your guidance on obtaining consent for the telehealth?
Okay, so what we have in our guidance document is a sample template for a consent form, and that's 3 pages long. Along the way, people have tried to follow our guidance, and I've come across how they've tried to do it, and I've tried it myself and how I do it. So I can send the consent form via email to the patient. It's part of our pre-visit package that they have to sign a consent form before they can even schedule. At least that's for my private practice. Now, some of them are not very well versed with email, so I use Telegram because then they can send a picture of the consent form that they have signed. Some of them don't have a printer, so they can't even print the consent form. So I send them a picture, 3 pictures, 1 picture for each page, and then they can like draw their signature on their phone, sort of annotate the picture. So that's how they've sent it to me as well. Some of our trainees in the government hospital ask for a verbal consent because it's via telephone, and then they just document it on the electronic medical record that patient has verbally given consent. So we have a Data Privacy Act in the Philippines that's very strict about obtaining consent. But in that law, it just says that it has to be recorded. So that leaves a very liberal way of actually saying that you've documented consent. Some people will say that if you have a video recording, you ask the patient before proceeding, do you agree to this telemedicine consult? And you have it on record on the video that should be enough. So that's why we're really waiting for more legal guidance on what would be adequate consent. And just before this meeting, Dr. Marcel and I were discussing, because now people are asking, since they do telemedicine a lot more, whether they have to get the consent at each and every visit, or whether there should be only one consent and that should cover as many visits already. But in our guidance, we did say at every visit because circumstances can change.
Okay, thank you, Dr. Iris. To all participants, if you have any question, you may type in the chat box.
Azurin?
Yes, Dr.
This is Dr. Al. Yes. I'd like to have a follow-up question with Dr. Iris. Maybe the output is already there, and we thank you and the team for coming up with it. But what do you think made it easy for you to be able to come up with those set of documents? Because not other countries, I've been doing a poll of other countries in Asia, and not many of them actually have anything similar. So what do you think were the environmental factors that enabled you and your team to come up with this set of documents? Over.
Well, we were all on quarantine, that's one. So the students were stuck at home. Some of them are here, maybe they can say. So they were more enthusiastic about finishing the project together, I guess. And we would meet weekly. So we would meet every Monday at 6 o'clock. And that cadence, that regularity of our meeting pushed us to move forward. So we would assign tasks during our Monday meetings. We would review who wrote what and what should we write next, and then decide whether we should release the document or not. So there were people who would volunteer for certain sections of the document, and then we'd have a read through on the Monday to see if everything is falling into place and if there were any questions. So I think the regular Zoom meetings helped, and then structuring it in the form of sections also made it easier, I think, to do the literature review, because we only wanted literature that would help us answer the questions directly, because we were trying to make it as practical as possible. But now that we've done it, I guess the question for me is, how else should we structure what we've made? So the possibilities we're looking at right now, as you know, is to come out with an ebook. We were discussing earlier on Twitter, should it be a playbook? But who would be the playbook for? And then should we submit it to a journal, etc.? Because now I have queries about, okay, you have the Google folder. I want to quote it in a document. How do I quote a Google folder? So we really sort of have to work that out as well.
Thank you, Dr.
So it's a combination of the demands of the situation, leadership and coordination, and also willingness of volunteers to help out and form the set of guidance documents. Do you think
Yes.
there will be more questions coming out and then more documents to follow, Dr. Iris?
Yes, I definitely think so. When I was invited to the Department of Trade and Industry, I was being asked about accreditation. So I was asking you, do you remember whether is there an ISO standard of some sort? What do we accredit? The process, the telemedicine provider? Is it supposed to be outcomes based? And then I did have a module with the Philippine Health Insurance Corporation where they're asking about reimbursement models as well. So there's still a lot more questions. And for me, really, in the UP Manila, the University of the Philippines Manila, we now have a telehealth committee that is composed of the different colleges inside the university. So we will have dentistry, allied medical professions, we have pharmacy, etc. So all these would also should have their own guidance documents. And because most of us were doctors in the group that made this, or nurses, so this is more focused on the medical field, but not, for example, on telepharmacy or on telerehabilitation, for example, for physical therapy, etc. So there's really a lot more guidance documents, and we're hoping that it's the medical specialty organizations now who would also contribute.
Thank you. Some participants were sending me private messages and asking me, are those questions that you used to develop the guidance document, can they use those same questions but then form their own expert doctors to craft their own answers? I know your answer, but I'd like you to say it yourself.
Oh, I should think so, yes. And it would be interesting to see if the answers will be the same. Because what happened was we reviewed the literature, and most of the literature will be coming from the more advanced countries, and they couldn't answer some of our questions. Like for doing telephone consultations, I had to find literature way back in the 1990s for the other countries. And now we have this. So yes, I would agree for the others to use the questions, and I would be interested to see what the answers would be and if it might be different, so we can all share.
Okay, thank you, Dr. Elvin. Thank you, Dr. Iris. I think there's no further question from our attendees today. So thank you to all. Thank you to all our speaker and rectors for sharing their expertise with the AHIN committee.
Thank you, Azurin. Don't forget to register at ahin.org. We have a lot of webinars coming soon, and one of them would be on the Broadband Commission. Thank you, everyone. Good night. Thank you, Dr. Iris. Good night.
Good night.
Thank you all.